All right, everybody. Thank you for joining us. And I'm Dr. Lori Ponsford Hill, and this is Mind Body Relationship, where we talk about the mind and the body and the relationship. And this is Susan. Susan has been our BSW intern for quite a few months now. And this is Courtney, who has also been a master's intern for quite a few months now. And both of you worked on a project together, which was to do with chronic pain. You did a lot of learning about chronic pain. Yeah, and what did you learn about chronic pain?
This is a new topic for me. That's kind of why I chose to take it on. So the whole experience was a learning experience for me. And it was just interesting how much of a diverse, connection there is between the body and like the different types of professionals it takes to really help someone manage this process. And also kind of how much little research is on it for psychotherapy. So it's kind of interesting to create this aid for therapists in case they come across a client and don't really know where to start or what to do with them. So
Oh, that sounds really good. And so when we're talking about chronic pain, what is chronic pain? What is pain?
Yeah, so when we're talking about chronic pain, we're talking about any pain that lasts more than 3 months, and it's either associated with, chronic diseases, terminal illnesses, or it can be the result of an illness.
Yeah, I think that it does cross the age spectrum, doesn't it? Anyone, from youth all the way up to old age, chronic pain can set in. I think generally too, it's really viewed as perhaps something like back pain, that sort of thing, right?
Yeah, where, back pain, if you're working in industrial settings, it's a common outcome in terms of the ergonomics of your workplace. It can be a outcome of certain treatments with respect, or certain diagnosis with respect to cancer. And it, apparently, our research says that at least 2/3 of Canadians live with chronic pain. That's anywhere from moderate to severe.
Wow, that is a lot of people, right? And I mean, it can be abdominal, right? It can be head, it can be back, and legs, even in regards to not being able to sleep, that sort of thing, restless leg syndrome, or whatever it is that might be. And I think anything to do with stress, right? Stress is very hard on the body.
Correct.
And pain ages. Yeah. So or what did you learn in regards to how chronic pain management applies? What are the things that need to be put in place?
there's definitely like a multidisciplinary approach you can take. So along with psychotherapy, you can also see physiotherapists, your general practitioner, if you need medications. Along the lines of psychotherapy, there's different types of modalities you can take depending on how severe the situation is or what's kind of going on with the client. And then that can kind of help resolve or fix the underlying issues there. So in our presentation, we kind of focused on CBT, operant behavioral therapy, mindfulness-based stress reduction, and then another one we had was acceptance and commitment therapy.
Oh, okay. That's very good. That's very good. Yes, a lot to do with learning how to relax, perhaps, right? And learning how to breathe, even through chronic pain, right? Like progressive muscle relaxation, that sort of thing. Visualization, maybe meditations. Yeah, and perhaps learning how to Well, learning how to change your thoughts, I suppose, as opposed to concentrating on the chronic pain, to change the thoughts to something that wouldn't get in the way of perhaps going to sleep. Which would be your CBT, right? And your acceptance commitment for how to really accept the place where it is that you're at.
Yeah, there's a large component, I would say, as you've referred to both Courtney and Lori, is self-management of the symptoms, because they are often, the medical community has, there's a lot of difficulty in diagnosing, or at least the treatment. And so, currently options medically tend to focus on opioids. And we know obviously there is a component of addiction and then withdrawal in terms of treatment of pain. But there are a larger importance should be put on the self-management of pain.
Yeah, because there is a cycle to pain, isn't there? Like a chronic pain cycle, where it is that people perhaps might feel better, start to push themselves. They want to get stuff done that they, weren't able to do when it is that they were in, severe pain. And then they push themselves too far, too hard, then they crash, and then they're out, and then they're back into their pain again. Had you noticed that chronic pain cycle?
Yeah, I noticed it with respect to exactly that, especially when individuals are trying to manage, like as a BSW student, I looked at the lens of, for example, the family unit. So someone's feeling well, they're able to manage household chores, their activities of daily living. They may perhaps be able to go to work for a small period of time. They've taken, from a leave, for example, and then they have that relapse where then, everything then crashes. They're not able to return to work. They're stressed. They're having difficulties with sleeping. Their children or family members may be impacted in terms of unintended negligence. And so, yeah, that's also part of the cycle that you speak of.
Yes. And different mood issues can, right? Like, for example, depression, anxiety, and depression to do with the things that have happened in the past, anxiety, fear of the future, perhaps also to hopelessness. This is never going to go away. I'm never going to feel any better. I mean, that sort of thing. And just, and there's also a grief process that goes along with that as well. Do you have any thoughts on that, Courtney?
Yeah, for sure. Definitely in our presentation, we kind of highlight the biopsychosocial model. And that's definitely a good focus for the treatment, just because there's so many underlying factors in the whole pain experience. So for psychologicals, there's for sure like the negative pain effect, things like answer seeking, catastrophizing, addressing those things, pain self-efficacy, their confidence, to manage the pain. And then on the social level, like Susan said, depends on their family members and how much they're involved, either if they're punishing, kind of ignoring the people in pain, or if they're overbearing and kind of enabling the pain to get worse and allowing them to feel the pain rather than manage it. And then there's finally the behavioral aspects. So just like the behaviors they do, like over or under activity. So overexerting themselves, underexerting themselves. So we've outlined in the presentation things like graded and pacing activity is really helpful, just to see where the person's at and not pushing themselves, but also not pushing, like underworking for managing their pain.
Yeah. And having a strategy is really, really important, right? To be able to monitor yourself, to know exactly where it is that you're at. Movement is really, really important. Even when it is a person is experiencing chronic pain, feels like they shouldn't move, because when they move, they're in pain, but movement is actually really good for you and healthy for you. So achieving movement in a way in which it's going to facilitate whatever it is happening in the body in a positive way. However, to do something is also really extremely important as well. And of course, the other is to do with that stress management, right? How to manage the stress so that you're not overstressing yourself and causing even more difficulties with whatever the condition might be. And also to social support, I think, is really important as well, right? Having that support system so that you can rely upon and depend upon others and feeling that you're not alone. Even support groups are really helpful so that you can converse with other people who are experiencing similar situations to get some really, added insight into what might be helpful, that sort of thing, right?
Yeah. So yeah, I think one of the experiences, that we also found in our research was the self-isolation, due to, two pieces, their own, self-isolation from family, from friends, from coworkers who may not understand their experience or may have become frustrated with their experience. And then the other piece is the isolation that's created by professionals, like our own, the professional stigma that's in place in terms of, well, that person's just self-medicating or they're attention seeking, or, as Courtney mentioned earlier, they're catastrophizing, and that it's not real. And therefore they're just kind of like, okay, well, we're going to focus on your addiction rather than the underlying pain.
Mm-hmm. Yes, for sure. Yeah, and it must be very, very difficult for people who are in relationships when it is that one partner has developed some sort of chronic pain, and so they're not able any longer to do certain things that perhaps was a connector within the relationship. Going out and playing baseball with the kids, or even going for a walk might have to change, and that sort of thing. And so therefore, of course, the relationship and the boundaries in the relationship have to change as well. Which can be a difficult issue to try to come to terms with. And then back to that grief process, right? That it's actually really getting in touch with that sense of loss and dealing with that loss, and then deciding, well, what are the other options? What are the other alternatives? What else is it that we can do? Yeah. And that I do think that the difficulty is that people don't know other people's pain, right? It's easy when it is that it's on the outside and you can clearly see it, so you can identify it, but generally speaking, pain is hidden within the body, and so it's hard to actually really know, right? And whether it's psychological pain or emotional pain, right? It could be spiritual pain, relationship pain, and also to physical pain, right? All of the different components of pain.
I think like any other trauma, two people can experience the exact same incident. And, when it comes, we talked about like abdominal pain or injury, you could experience, relatively the exact same experience in terms of how the incident happened, but the impact will differ, just like any other trauma. And pain is chronic pain is an experience of trauma.
Yeah, that's so true, right? The pain scale, generally speaking, is 0 to 10, right? To number your pain where it is. And some people have really high pain tolerance, right? And so, they actually rate it very low, and other people do not have high pain tolerance and everything is a 10.
Right.
And if you want to be seen by the medical profession, best to circle the 10. Right? But there's no standard way in which to really measure pain, is there? It's totally subjective, and based upon that is you just have to be able to really go with it. For that person, it's a 10, right? And then to deal with it accordingly.
In our research, we also found that really depends how strongly they identify with the pain and who they are. If it's negatively impacted their identity and who they are and what they've become, that can be a hard impact on creating change or wanting treatment or seeing, you know, the light at the end of the tunnel. So like in the term like hurt versus harm, some people don't see their chronic pain as stable, even though it may be. They see it as like an ongoing decrease or decline in their life or ability to do things. So really trying to, I don't know, address the identity issue there as well, and kind of separating the pain from who they are and who they used to be or who they want to be, and aligning that with like their values and what they want in life is kind of helpful with all that too, and seeing how they can kind of separate the two.
That's a good point. Yeah. You know, I think that the one thing that people do say is that when it is that they wake up in the morning, the hope is that they're not going to experience their depression. They're not going to experience their anxiety. They're not going to experience their pain, but they open their eyes and then there it is. Any suggestions for people who actually really do that? Oh no, there it is. It's still there.
I would say definitely mindfulness, just really learning of giving like a rational experience to the pain, you know, real perception of what you're experiencing rather than just labeling it as severe pain. Just really trying to understand what that is to you and what the tolerance level is and where you lie on that. And then maybe as you become more aware of what you're experiencing, you may also learn what you can tolerate, what you can't, and things like that, what your limits are.
Mm-hmm.
Yeah,
Any thoughts, Susan?
Yeah, I would agree. I think, you know, at least in my research, I found that the best outcomes were for those who had the most knowledge about their pain. From, you know, so if it was a result of, for example, surgery, if they were walked through what the potential looks like, rather than just getting a leaflet or a piece of paper at the end as you're being rolled out the door, if they had some really comprehensive education at the beginning, the tools that we've talked about, whether it's mindfulness, you know, hypnotherapy, box breathing, etc., and to regular interactions with their team, their health team, that multidisciplinary team, they had the best outcomes. So when they were able to really, as you said, Courtney, visualize it, describe it, put a name to what that looks like, then it was less of a shock to their system.
Yeah, to be able to externalize it from the self, right? That, and that it's about something, right? It's actually really speaking to you. It says something about what's going on inside of you. Yeah. Any research in regards to pain medication? I know that generally speaking, pain management medication wise is not necessarily the answer. And sometimes it doesn't even touch the pain. Any research in regards to medication at all?
Yeah, sorry, that it certainly has its use in terms of acute pain, but that overall, as a community, it's not, you know, it's not been managed well. Canada's experiencing an opioid crisis. Anyone in the health profession has received, I think, anywhere from 14 to maybe 40 hours of education on how to manage pain. You know, coincidentally, veterinarians get about 87. So that tells you how much we know about the management of human pain.
So totally true, right? Yeah, the animal comes in, first thing they do, they give pain meds.
Yeah, so you know, you have the horse whisperer, apparently has better knowledge about how to, you know, what's going on than we do with humans. And just, there's been a heavy reliance on pain medication, which is not to say that it's not an important piece, but it certainly should not be done in isolation, particularly when we look at opioids and the potential for addiction, and then managing addiction and its impact.
For sure, for sure. Because a lot of these medications actually really are addictive, aren't they? Yeah. And so there's long-term consequences because there's side effects to them as well, right? So then it becomes managing the side effects to the medication. Yeah. All right. Well, thank you so much for joining me today. Any final words at all in regards to chronic pain management?
This was an interesting topic to learn about. I didn't really understand what it meant, which is why I said earlier we took it on in a sense. We just hope that this was kind of like a guide for new therapists or therapists who are already practicing, just to understand this topic a bit more. Because as we mentioned, this isn't really a broadly talked about topic, especially in psychotherapy. So we just hope this can be a bit helpful and give some people an idea on how to treat those who are suffering and kind of understand more.
Yeah, integrate it into practice.
Mhm.
Yeah. Well, that's fantastic. Well, thank you both very much for joining me. I really appreciate that. Yeah. And thank you all for joining us. And please give this video a like and subscribe. All right.
Thank you.
And congratulations for the two of you. I know that, within the next little while, you're going to be winding down your internships. You're going to be moving on into your careers. And congratulations. Yes.
Thank you, Lori.
Yeah, glad to have you at the Counseling House.